When I first came to Malawi, I met a young woman whose name in Chichewa, our local language, means, "And next comes the grave." So saddened by this, I asked her the origin of her name, and she said that she was the 8th born in her family, and all previous 7 children had died in infancy. We see the heavy burden of death and disease that people bear in Malawi. It's been my privilege to serve, the last 10 of which have been with our partner church in Malawi, the Church of Central Africa Presbyterian. I'm honored to greet you on behalf of this church, which sends its sincere gratitude for the ways that you have partnered with us to enable health ministries and the evangelism to go forward. Malawi is a small country in southern Africa which has over 3 million Presbyterians. Sadly, there are tragically high death rates among vulnerable people such as pregnant women and young children. A Malawian pastor that I know well shared that every family in Malawi has been touched by a maternal death. And our health surveys in Malawi have shown that nearly 1 in every 10 children in Malawi will not live to school age. I've been working with Children's Health Service at Nkoma Hospital for the past 10 years. Our hospital and its health centers serve a population of more than 300,000. Because of the concerted efforts of the hospital in educating health workers, in trying to put into place clinical best practices and quality improvement, because of really sacrificial devotion of the healthcare teams at the hospital, and because of the partnership of friends such as you, the Presbyterian Church USA, we are blessed to say that we've been able to change some of these terrible statistics. The Presbyterian Church for the past 5 years has provided us funds to do indoor residual spraying for mosquitoes, where we go to village homes and spray to kill the mosquitoes that carry the malaria parasite. We've also received distribution of insecticide-treated bed nets, which again helps people not to suffer from malaria. As a result of this, the number of sick children coming into Nkoma Hospital has decreased from over 10,000 in the year of 2010 down to about 3,000 in 2013. Deaths among mothers in our hospital's catchment area, the area of our responsibility, have actually fallen by 75% over the past 10 years. The deaths of the children that are admitted to our pediatrics ward have fallen by 80%, which means that when people come to our hospital, they expect to live. Our hearts can be filled with joy. Instead of a name that is a harbinger of death, we now hear names like Chisangalala, joy, Chimwemwe, happiness, and Madalitso, gift. It has been a great gift for us, the Church of Central Africa Presbyterian, and your mission staff to partner with you, Presbyterian Church USA, in bringing God's kingdom to every area of Malawi and of our hearts with you. We thank you in the incredibly gracious way of Malawians and say we do not take this for granted. We ask you to continue to partner with us in your prayers, in your correspondence, in reading and sharing our mission correspondence letters, in your presence if God leads and enables, and certainly in continuing your financial support, without which much of this would not have been possible. Thank you, and God be with you.